All right, perfect. So BSI, you're seen safe. Come up looking at the patient. So first of all, I want to say personal partner and patient safety. Do I have any environmental hazards right now? So just see one patient lying on the ground. Seems to be a traumatic mechanism of injury. Maybe like he fell off one of these buildings here. I'm going to go ahead and activate advanced life support for my additional resources, and there's no need for extrication at this time. We will have someone go ahead and hold his spine, so I'll direct my assistant to go ahead and do that right now. General impression, I got a 20-year-old male lying supine on his back, seems to be unresponsive. So come up, go ahead and assess responsiveness. Sir, can you hear me? Can you hear me? Go ahead and pat him. Nope. Go ahead and do some painful stimuli. He responds to painful stimuli. So I'm going to go ahead and open his airway up here with a jaw thrust. All right, is his airway clear?
Airway is clear.
Awesome. Assessing his breathing right now. Does he have equal bilateral chest rise and fall? Is it adequate rate? Okay. We're going to go ahead and throw oxygen on him just because this is a traumatic scenario. Assess his pulse here. Is it regular?
It is regular.
Okay. Rate is fine. Any signs of bleeding, major bleeding, anything like that?
None at this
Okay. Awesome. We go ahead. Is there any bystanders right now?
There are no bystanders.
Okay, so we won't be able to get a sample history from that then. So now I'm going to go ahead into my, this is a high-level trauma patient from what we can tell right now since he's unresponsive. And let's see, we're going to go ahead into our rapid trauma assessment starting from the head and moving all the way down. So at the top of the head here, pressing, looking for any open skull fractures, any signs of blood. I'm going to open up his eyes, assess his pupils, go ahead and look in his ears here. In his ears, no signs of bleeding. Nothing, no other drainage, no battle signs. Feel down his neck, which we already would have done earlier, but do you have any pain in his neck right now? Okay. So we open his mouth again. We can always reassess his mouth at this point, see if there's any broken teeth, if there's any blood, any sort of secretions that we need to remove. Look in his nose, see if there's any blood, anything right there. Come down to his neck. I'm going to assess if he has any tracheal deviation, any subcutaneous emphysema, if he has any medical alert tags, anything like that. So if we don't see anything, we're going to go ahead and expose him. Probably cut this stuff off. So we're going to expose him as we do this here. So start from the top, push down on one shoulder, push down on the other. You can feel the clavicles, you feel the head, come down here. So I see some sort of injury to his left chest here. Keep going. Feel his chest cavity. So is there any crepitus, any sort of paradoxical or flail segments? Nothing like that. Okay, we can push on his sternum here. Feels intact. Move on down to his abdomen. Push on one quadrant. Any sort of rigidity or distension?
None in the abdomen.
Okay, awesome. Come into his hips, pull up. He has no pain there, then I'll pull up first. If there's no pain or any instability, then I can also push down after that. Go ahead and check down the surface of his legs. Big hands to get all the way down. Okay, you can go ahead and check the pulses down here. If he was alert, we'd have him do the pedal pushes and some neuro stuff are there. Also, we should assess his perineum and genitalia if need be. At this time, we're also going to roll him. So because he has deformity on this side, we're going to roll him towards me. So this will be on heads count. Pull him up. Awesome. So now I can go ahead and feel down his back, any step-offs, any sort of deformities. Nothing, any sacral edema. I'm also going to listen to breath sounds right now. Go ahead and roll him back down. I'd like to get a full set of vital signs on him: pulse, blood pressure, respirations, SpO2 saturation. We're going to go ahead and collar and backboard him as well, and we'll transport code through to the hospital. Hopefully ALS intercepts us and meets us on scene. We're going to continue to reassess him every 5 minutes en route. We're going to treat for shock the entire time, keep him warm, keep the oxygen on him, and trend all of our vital signs.